Hello everybody, मैं हूँ Dr Kukreja A Kalani. I have been practicing homeopathy since last 24 years and we deal with treating all chronic ailments. आज बात करेंगे psoriasis को लेके. psoriasis is a chronic skin problem. डिटेल में हम बताएंगे इसके लक्षण क्या है और उसका ट्रीटमेंट क्या है होम्योपैथी में. Psoriasis is basically a chronic disease which is also a autoimmune condition. psoriasis में basically क्या होता है कि जो स्किन के सेल्स होते हैं वो बहुत ही फास्ट डेवलप होते हैं. It is basically a rapid buildup of your skin cells and because of this it leads to excessive scaling. एंड ये एक्सेसिव स्केलिंग के कारण वहाँ पे बहुत ज़्यादा रेडनेस इन्फ्लेमेशन हो जाता है अराउंड द स्केल्स एंड बिकॉज ऑफ द टेंडर स्किन कंडीशन इट कैन ऑल्सो crack and bleed. Psoriasis is basically a speed up skin production process where the skin cells grow deep in your skin and slowly rise to the surface. Eventually they fall off. The typical life cycle of skin cell is 1 month. एक महीना लगता है the skin cells to form. बट ड्यूरिंग द प्रोसेस ऑफ सोरियासिस ये जो साइकिल है ये 1 या 2 हफ्ते में ही कंप्लीट हो जाती है. इसकी वजह से एक्सेसिव स्किन स्केलिंग होना शुरू होती है, रेडनेस होना शुरू होता है एंड इवेंचुअली जैसे पहले भी मैंने बताया वहाँ पे क्रैक्स और ब्लीडिंग होना शुरू हो जाती है. दीज स्केल्स टिपिकली डेवलप ऑन द जॉइंट्स सच एज एल्बोज एंड नीज. However, they may also develop on the other parts of the body like hands, feet, neck, scalp and face. ये जो कंडीशन है ये कभी कभी नेल्स में भी पाई जाती है which are called as pitted psoriatic nails where the texture of the nails becomes uneven and the growth of the nails also is not normal. They basically grow crooked and that is called as a psoriatic nail condition. And the lesions can sometimes be found in the mouth or also on the private parts. आगे अगर ये बोला जाए कि इट इज़ psoriasis is usually found associated with type 2 diabetes, IBS syndrome and also along with heart disease and psoriatic arthritis and जो लोगों में anxiety and depression होता है psoriasis उनमें भी commonly पाया जाता है. Now what are the different types of psoriasis? तो इसको briefly हम लोग समझेंगे. Basically there is plaque psoriasis which is the most common type of psoriasis. These patches are usually white silver scales or plaques and they often have they can form too much of a thick scaling which leads to hardened areas and once if you overuse that joint or your the affected area comes in contact with say too much of water or detergent they tend to break open. There is a breach in the continuity of the skin and these cracks later can ooze out liquid and also blood. It becomes a very very painful condition. This is plaque psoriasis. Next is guttate psoriasis where you will find small pink or violet spots spread all over the body. It usually happens in childhood. The next is pustular psoriasis. यहाँ पे क्या होता है the skin it becomes very much inflamed और underneath उसके skin के नीचे बहुत ज़्यादा पस जमा हो जाता है which eventually forms lot of blisters and it is also a very very painful condition. The fourth type is inverse psoriasis and last is erythrodermic psoriasis. What are the symptoms? अगर हम पूछें कि आप बताएं आपको कि what are the symptoms of psoriasis? The most common symptoms of psoriasis include raised inflamed patches of skin which appear red on the light area and brown or purple on the dark skin. They usually appear as whitish silver scales. The dry skin may crack and bleed. There is lot of soreness around the patches and because of all this condition वहाँ पे लोगों को बहुत uneasy feel होता है, burning sensation होती है और बहुत ज़्यादा itching भी feel होती है. Then, as we also discussed about the affection of nails, so you may find the nail texture to be not normal. The nails are very thickened and there's lot of pitting on the nails, which are called as pitted nails. जॉइंट्स के अफेक्शन के कारण बिकॉज ऑफ द कंटिन्यूस द साइकिल जो इनकी रहती है ऑफ द फ्लेयरिंग अप एंड रेमिशन, उसके कारण जो फोल्ड्स होते हैं वहाँ पे स्किन बहुत थिक हो जाती है एंड बिकॉज ऑफ दिस यू फाइंड पेनफुल स्वोलन जॉइंट्स. So now what do we usually notice in such people who have psoriasis? Not every person will experience all the symptoms which I have been telling you. Some experience few symptoms, some experience very severe symptoms depending upon each person's immunity, how well they are able to cope up with the environmental conditions and the stress levels also. Most people with psoriasis will go through cycles of symptoms. So the condition may cause very severe symptoms for few days or weeks and then the symptoms clear away by themselves. मतलब कोई समय ये बहुत ज़्यादा severe हो जाता है कि and after a while, after they respond to medicine, there comes a period of remission where the symptoms are better and the patient is feeling overall better because now the it is in a remission phase. So you have alternate cycles of say flaring up and remissions. So that's why it is called as a chronic problem. Next is basically we'd like to tell you now, if you ask me whether psoriasis is contagious, we like to tell you here that it is not contagious. It cannot pass from one person to another by touch. So touching a psoriatic lesion on another person will not cause you to develop this condition. Now, what are the causes of psoriasis? So basically, as we have discussed, it's an immunity issue. So whenever your immunity levels are low or you are having repeated infections like bacterial or viral, इसमें जब immunity compromise हो जाती है तो you usually find these psoriatic ailments coming up very quickly. They surface. Next very important which we have seen is that it runs in families. So in case you have a family member you've had who had suffered from a full blown picture of psoriasis, so likely chances that the siblings or the son or the daughter or anybody else can also have a similar type of condition. So it is basically genetically inherited problem. Now ऑटोइम्यून क्या होता है इसके बारे में अगर हम जानना चाहें तो ये बोल सकते हैं दैट like the body is a castle and your immune system is your army. So and the army fights off the invaders like the bacteria or any foreign material. So if the fighting जो force रहता है, if begins to malfunctions and it attacks your own body, then ये problem शुरू होती है. So basically in simple words we can say that जो body का immune cells होते हैं, जो neutrophils या T cells रहते हैं, they are not able to identify the invader, be it the microbes or be it any foreign material, and they by mistake they attack their own healthy tissues. इसकी वजह से there is an inflammation, redness and body pains and aches which is absolutely of unknown origin. ये क्यों होता है ये पता नहीं. So basically because of the heightened immune system reaction, which is a absurd reaction to the invasion, the body is not able to identify whether between the foreign cells and your healthy tissues. So by mistake, instead of reacting to microbes or the foreign invaders, it attacks its own healthy tissues, resulting in an autoimmune nature of the disease. हाँ, अगर हम बात करें what are the risk and trigger factors about psoriasis, so we should mention this that it is run in families, meaning if अगर आपके फैमिली में किसी को सोरियाटिक प्रॉब्लम रहा है, सो चांसेस हैं कि आपको भी हो सकता है. सो इट्स बेसिकली person who's had a history of psoriasis in the family is genetically predisposed to getting psoriasis. Secondly, क्रोनिक वायरल और बैक्टीरियल इन्फेक्शंस जैसे स्ट्रेप थ्रोट होता है या HIV वायरस रहता है, जहाँ पे आपका इम्यून सिस्टम बहुत कॉम्प्रोमाइज़ हो जाता है, यहाँ पे भी इन पेशेंट्स में सोरियासिस देखा गया है. Then we talk about the stress levels. So this is very important factor that has been noted, that whenever there are flare-ups of psoriasis, the trigger factor is long periods of stress where you are prone to anxiety and restlessness, less of sleep. So all these things contribute to high stress levels and they trigger and they maintain psoriasis. Then we come to the obesity. It has been found that people who are obese have severe problems when it comes to skin eruptions, and the psoriasis tends to spread very quickly. So in case you have psoriasis and you have obesity tendency, you can always check upon the additional weight, and the aim should be to get to the healthy weight level. So basically you have to try and maintain healthy weight. Then we come to smoking and alcohol. These are the habits. So it has been definitely found that smoking and alcohol has a negative impact upon the presence of the symptoms. The psoriasis gets aggravated if you are smoking or you are dependent upon alcohol. Then there has been research where it has been seen that people with less of vitamin D